All right, so now we're going to talk about central nervous system injuries that may happen with a newborn. What are the risk factors for any central nervous system injury, in particular for brain injuries? Prematurity, low birth weight or very low birth weight, high risk pregnancy, anything that indicates poor perfusion in utero in a difficult or traumatic birth. So I want you to think about how each of those could contribute to a brain injury. So first of all, talking about brain injuries, possibly the most common is hypoxic brain injury. This is not progressive. This is basically like a stroke. Part of the brain or all of the brain loses oxygenation at some point, either in utero, during delivery, or after birth. What does this look like? This baby may have seizures. They may have abnormal muscle tone. Either they're very floppy or they may have increased muscle tone and be very rigid and tight, hypertonicity. They may have muscle weakness. They may not be able to coordinate, suck, and swallow well. They may have apneic episodes because remember, the brain is what reminds us to breathe. They may actually be comatose or near comatose. Long-term, they may be diagnosed with cerebral palsy. Sometimes if they have less severe deficits, they may not be noted until they start missing milestones or struggling with academics or behavior. So this can range from very minimal symptoms that are not noticeable until they're older to profound brain injury symptoms. The management, well, ideally, we want to prevent this. We want to prevent hypoxia in utero. We want to prevent hypoxia in labor, and we want to prevent hypoxia in the newborn. If this has occurred, then the treatment is supportive care. If they're struggling with respiration or ventilation, then they need ventilation. They may need to be on a ventilator. We want to make sure that the brain stays perfused at all times. So we want to make sure we're maintaining cerebral perfusion. We want to prevent cerebral edema. If there's any kind of brain injury, we can have swelling. So we want to prevent cerebral edema. We want to treat whatever is causing the loss of oxygen to the brain. Seizures are treated with meds. Therapeutic hypothermia can actually minimize the damage. So that's something that sometimes is done. In preterm labor, remember that we may give mag sulfate to try to decrease the risk of this. Another potential brain injury we may see is intraventricular hemorrhage. This is bleeding into the ventricles. Remember, the ventricles are those openings in the brain tissue where the cerebrospinal fluid circulates through the spine, through the ventricles, and then back around. Bleeding into the ventricles is more likely to be arterial. If this is a severe bleed, you may see a sudden change in that child's status. They may get suddenly much, much worse. If it's a smaller bleed, they may not have symptoms at first. So if you have a small bleed, it may be asymptomatic at first, and then you may start to see increasing symptoms. So what are those going to look like? Think about neurologic symptoms. They may have twitching, stupor, apneic episodes, seizures. They may, if there's increased intracranial pressure, that anterior fontanelle may bulge. If you're seeing those symptoms, they probably need an ultrasound or MRI for diagnosis. The management of that is supportive care. Keep them ventilated, keep them well oxygenated because hypoxia increases brain swelling. Manage fluid electrolytes and acid-base balance. They're going to need meds for seizures or to prevent seizures. Ventricular drainage, if they have increased intracranial pressure, they may actually put a drain into the ventricle to relieve that pressure some. And at all costs, we want to avoid increased intracranial pressure. An intracranial hemorrhage may be from either veins or arteries, and it may be in several different locations. You're going to have to go back and remember the meninges, the layers of that lining to the brain and spinal cord. A subdural hematoma is below the dura, and usually it is venous. And so usually it is a slower bleed. You're going to have slower onset of symptoms, and you're going to have symptoms that show gradually increasing pressure, and usually in one spot. A subarachnoid hemorrhage is below the arachnoid space. It's in the arachnoid space, and it's more likely to be arterial. And also that blood is going to be much more diffuse, and it can cause vasospasm. So you're going to see usually faster symptoms and possibly more severe ones. An intracerebellar hemorrhage may also occur. What do these hemorrhages look like? They may have a sudden change, a sudden decrease in the hematocrit, because remember, babies don't have a lot of blood to give up. You may see neurologic symptoms. Poor feeding is a big one. One last central nervous system injury to be aware of is spinal cord injuries. They may actually occur due to a traumatic birth, which would be rare, or due to spina bifida. And the signs of those depend on the location of the injury.